everybody. Welcome to the Medicare Cafe. We're doing our pre-chat
Good morning.
where we log on a little bit early. So welcome. You're joined with your hosts, as always. My name's Olivia Richardson.
And I'm Carrie Vogt.
And
I feel like we haven't introduced ourselves in a while.
We've
That's weird.
We've not been good at this.
Yeah.
But I'm actually really excited. So it's so funny. My favorite part of my Tuesday is like the 15 minutes that Carrie and I get to like catch up before we actually start streaming and just kind of talk about like. So what
I
are
tell
we talking
her all
about
my
today?
like crazy client stories.
Yeah, tell me about
like.
your crazy clients and tell me what's going on. And some of them are hilarious. Some of them are just like, what the hell? So tell me about this guy that you were just telling me about. Let our audience know about this really wealthy client who.
Yep. He's in the highest IRMA tier, paying $500 and some a month for his Part B plus the $70 for his Part D. So he's paying out a lot of money for his Medicare.
But again, he's making, what is the highest tier income level?
You have to have above $500,000.
Okay, so yeah, he's doing quite well.
Yes. But I've always said this. I feel like people that have money, a lot of people that have money, they have money because they're penny pinchers.
For sure. It's the wealthy ones that are like, no, I want to do whatever I can to save that $7.
Yes. And so,
there we go.
And so, went over the pathways with him, and this was our third meeting we had just 30 minutes ago.
That's crazy.
Because he was so torn about what to do. He also had like multiple retiree options also.
Okay.
But they were terrible options. So those were off the table from the get-go.
Got it.
But anyways,
But he wanted all these options, just to clarify, because like he knew he wanted a med sup.
Yeah,
but
I was like, well, what are we debating? He was like, well, if there's one thing I know for sure, I know I want a Medicare supplement.
When that took 3 meetings, and he was for sure knew he wanted Medicare. Okay.
And he was like, I know I'm not going to be paying IRMA forever. He had a lot of like higher income for a couple years. And he was like, I just want to save money while I'm paying IRMA. So we talked about like trial rights with an advantage, and he was like, that's what I want to do. So his first, year at 65 is going to do a trial right in an advantage plan, and then we already set our meeting for next July to switch to a med sup.
Because when you were first telling me this, I was like listening. I was like, wait, so like, what
just
is
to
he
save money on his premiums?
That's what I was like. He was like, yeah, to save money. I'm like, what is he saving money on? Is he getting like a rebate? Because like thinking about this high Part B, she's like, no, he doesn't want to pay a med sup premium. And just for a year, it's worth it to him to do that extra shopping, to kind of have this like to be in something that he genuinely doesn't want.
And he was really funny because he was like,
sounds funny.
He walked in and he had his head down. He was like, I'm sorry. How many clients do you meet with 3 times? And he just like wouldn't even look at me. And I was like, it's okay, John. It's okay.
That makes me really happy that he's just like,
And he goes, if I'm your most high maintenance client, you can tell me. I was like, truly, you're not.
Here's the thing, though.
You're just having a hard time.
He's not. And
he's
the
not
reason,
at all.
So let me ask you this. Would you rather meet with, based on like your time versus just enjoying your job, somebody who is, who you're able to cross-sell, things like that, somebody that you only have to meet with once, but they aren't like receptive of your information, they don't appreciate you, they don't like, they're just kind of like, not even like a pain in the ass client, but like a jerk to work with.
Yes.
Versus somebody who is extremely high maintenance but really appreciates you.
I adored him. And he was one that when he brought in, he had 5 retiree plan options that were available to him.
How was he? Wait, what did he do?
He was a pharmacist for CVS.
And
had all of these, that was a whole nother story of what those plans looked like. I was baffled.
That CVS
how
just
terrible
offered,
they
like,
were.
Terrible. Like,
terrible.
as a health.
Like, we're talking $300 a month for, like, an advantage with a deductible.
Really?
Yes.
Gross.
Yes. And he brought all those, and he was like, so how much do I need to pay you to review these plans? And I was like, nothing. And he was like, come on, you are spending way too much time helping me. And, like, he tried to pay me multiple times. Like, so he was just a very, like, he understood that he was
not easy.
Yeah.
Do you ever have people who are like, this is too good to be true?
Yeah.
If you're not charging me for something, like, there's nothing in life is free, so I'm not comfortable because you're free.
Yes, and then I always say, okay, where do you have your home and auto with?
Mm-hmm.
Do you pay them?
Mm-hmm.
And they're like, no. And I was like, okay, well, that's the same thing.
Yeah, it's insurance.
And they're like, oh, okay.
So that's how you do that.
Yeah, that's how I do that.
I guess it makes sense because, like,
Everybody has home and auto.
Yeah, people are more familiar with it. There's a million commercials about Geico and okay, question off topic because who is topic? We don't know her. The chaos guy.
Oh, Mayhem.
Yeah. Okay, is he and Flo both progressive? Who is he with?
No,
Is he with Allstate? Who is he?
Yes, he's Allstate.
He's Allstate? Okay, so
he's Allstate.
Are you sure?
Positive.
Okay, I'm going to take your word for it.
He's Allstate. Flo is progressive.
But
Allstate, oh my gosh, with the Nat Gen, what if Mayhem makes an Allstate Medicare?
No, you're 100% right because Annie Larson, who is like our rep with National General, is like, yes, we want to do a Mayhem with Medicare.
Oh my gosh.
It's in talks. It's in the talks, but yes, that is something they're like, we've already talked about it.
Thought about that.
Trying to
hilarious.
get Mayhem to do Medicare supplement sales.
How would he get hurt? Like, what would he do?
I don't know. Can you get hurt, or could it be like, I guess Mayhem? Like, I don't want somebody getting hurt.
Right, you know what I mean? But
yeah,
like all of
because
his,
like seniors are protected. I don't want to watch a senior getting hurt.
Yeah, I don't know how they would fit that into his like.
I don't know.
Persona.
I'm here for it though. I love everything about what's happening here. Okay, let me get our text messages. All snake. I don't know what. Oh, all state.
Oh,
all state. Because he's in good hands.
Okay.
Ooh.
Yeah.
Okay. Next.
Sorry, is that my hair?
No, I think it's mine.
Could be.
Let's
I've
just
been
pretend.
shedding.
Another question we got. Again, guys, for any questions, comments, concerns, threats, or promises, you can text this number here below, or you can put it in the chat over there on the side.
Long one.
Ooh, okay. I love this one. I don't know what your name is, but I got your phone number here. That sounded really creepy.
Is it a compliance question?
It is. So
it's on topic.
It is on topic. So I'm gonna hold on to this and actually
Not like us.
Go ahead on topic. Again, don't know her. Let's go ahead, guys, and get started into today's topic. It's pretty simple. Today is an Ask Us Anything with an emphasis on compliance. Of course, you can ask us anything you want to, regardless if it's compliance or non-compliance. But I wanted to do this, and I'll tell you why. So,
I feel very close.
I like it.
I feel very close to the camera.
Oh, okay, fine. On Friday, Sadie and I, for Senior Marketing Specialist, did a United Healthcare rollout webinar. We went to last week. I was in Dallas to talk to United Healthcare about what their plans are going to look like. That webinar is recorded. It is on our toolkit. Make sure you take a look at it. It's nice.
Okay.
It's very good.
I can't wait to see it.
But the webinar itself ended up being over an hour and a half, and it was because there was about probably 45 minutes, if not longer, worth of people asking compliance questions.
No way.
And so I always feel like we have a lot of platforms for people to ask questions and reach out to us because there's been so much going on with compliance. And oh my gosh, guys, and I'm not going to say names, but I've been seeing such atrocious content lately of just blatantly wrong information about compliance and just saying they're not going to do it and all this stuff. And it's just, I was just watching this and I was just like, we cannot let people think this is true.
It's one thing to not agree with it, maybe not support it,
well,
but to not do it.
It's one thing
you're just
to say
putting your name on the line.
It's one thing to say, me as a person, I'm willing to risk my commissions. Because if you sell non-compliantly, you will lose your commissions. If not, if you continue to do it, you lose your contract. There's a progression of what that looks like. But oftentimes, if you do a non-compliant sale, you will not receive commissions on that.
Commissions. Commish, is that can we use that shorthand?
Yeah, commish.
You won't receive any commish.
You won't get any commish. And so we need to talk about what's going on with compliance and stuff. And it's not just call recording. There's a ton of other stuff that came out in those compliance updates and regulations, but wanted to start with that. So
what were some of the main questions from? Oh yeah, we'll start with this text.
Yes. And it was Terry. Good morning, Terry, an agent from Washington State. Welcome. The question was, again, guys, message us, text us, whatever you need to do, anything but carrier pigeons because those are gross and full of diseases. So other than that, Let us know what your questions are. The first question we asked from Terry in Washington said, what do you guys think of the new rule that we will have to put this statement on all marketing materials if you talk about any benefits or specific plans? The ones where I don't represent all the plans, and to know if you want to know more, call Medicare. Also, the statement if we call someone that has to say within the first 60 seconds. So I'm glad you asked that. Let me pull up. There is
it 60 seconds?
Yes. So just to
I thought it was like 30 seconds.
It's the first 60 within the first minute.
60.
So there has been, and let me pull up. I wanted people to ask this, so I got with our compliance officer ahead of time to ask this one specifically because there's a lot of gray.
Okay.
So
I feel like I need to take notes here.
You're more than welcome to. The recording of this will be available, so you can watch it
True.
after the fact.
I do know that. Yeah.
So there are basically 3 types of disclaimers. There's actually 18. But there's 3 types of disclaimers that field agencies need to be aware of. There's the TPMO, the affiliation, and the solicitation. So the solicitation, Terry, what you're asking about are marketing pieces.
Okay.
Which actually, so I'm going to answer this, and then I want to get into the discussion of, well, what is a marketing piece versus a communication?
Yeah.
So whenever you're doing a marketing piece, now with the marketing piece, what it comes down to, what makes a marketing piece is it something that's trying to convince somebody to either stay on their plan or to switch plans? So even if you're telling somebody like, hey, your plan looks great for 2023, there's no need to move, call me if you have any questions, which are great letters to send out to your clients, if that applies, those are considered marketing.
So something like, hey, come to my seminar I'm hosting on this date.
Well, you're advertising, no, because you're advertising a seminar. If that seminar is educational seminar, no, that's communication.
On there.
That's not marketing. Marketing is truly trying to convince somebody to stay on their plan or move their plan.
Okay.
Move to a new plan.
That's a good way to think of it.
Yes, that is, and the communication is, inviting them to a seminar, inviting them to an open house, sending out newsletters and things like that. If it's not trying to talk about move or stay, then it's not considered marketing.
Is this to new prospective clients or current clients?
Doesn't matter, both. If it's communication that talks to you to move or stay with your plan, both prospecting or current clients, it's considered marketing, and it requires the solicitation the solicitation jargon. And that solicitation one is basically saying, by responding to this ad, you may be contacted by a licensed insurance agent. So any marketing, anything that convinces them to either switch plans or stay on their plan, needs to say, by responding to this ad, you will be contacted by a licensed agent. That goes to your current book of business as well.
So I'm thinking of, and what I was getting ready to write down, is every September we send out newsletters to our current clients. It has a little personal snippet, about me, here's my new baby.
Yeah.
But then we also talk about,
look at the baby.
She's not new anymore. She'll be a year in a couple months or a couple weeks. So that would be, because we're talking about setting up AEP appointments.
If you're talking about setting an AEP appointment, that is considered marketing.
We don't say the word AEP.
If you're wanting to set an appointment, that's marketing. Because during that appointment, you're going to be talking about staying on their plan or moving plans.
So that disclaimer has to be said at the bottom.
By responding to this, you will be contacted by a licensed agent.
Okay.
Now
that one's on there, but not the.
We'll talk about that one here in a little bit. The other one is going to be the solicitation, that was a solicitation. That is a solicitation one. By responding to this ad, a licensed agent will be contacting you. Affiliation has to be done with basically all communication, which is basically saying I'm not affiliated or endorsed by any government agency. That one has to be on everything, communication and marketing. I am not affiliated with I'm not affiliated or endorsed by any government entity. Okay. The third one is the TPMO, which needs to be said in the beginning of every appointment. Doesn't matter if it's a face-to-face appointment. Doesn't matter if it's a telephonic or Zoom appointment. Doesn't matter the way that the appointment is done. This needs to be said in the beginning of every appointment. We do not, and within the first 60 seconds, like Terry mentioned, within the first 60 seconds, we do not offer every plan available in your area. Any information we provide is limited to those plans that we do offer. Please contact Medicare.gov or 1-800-MEDICARE to get the information for all of your options. Now, if you say it slowly, that's about a 15-second phrase that you have to say. So within that, it's how do you introduce that phrase? Where do you go from there, right? So my thing is I introduce it by saying, listen, we're discussing government-affiliated plans, so I have to give you this disclaimer. I say the disclaimer.
Okay.
At the end of it, I say, now listen, my job as an agent is to vet the carriers based on customer appreciation, or based on how they react with customers, based on the providers, based on what you need. So yes, there are going to be plans that I can't advertise, but I'm only going to have the plans that are suitable for you.
So, coming from someone who has 1 to 2 meetings with people, my first means of communication with somebody is usually either by phone or email, like setting up the appointment. Does it need to be said on that one?
No.
Or the one that's... But sometimes my first meeting doesn't lead to a sale, and I know it's not going to lead to a sale.
Yeah. It's
just the one that's going to...
If you're going to be presenting options, if you're going to be presenting policy options, MedSup versus MA, anything, that needs to be said. If you're just scheduling appointments, if you are answering questions, if you're doing any other type of marketing or communication, doesn't need it. This is only necessary whenever you are going to be presenting plans, presenting options for your clients.
Okay.
So again, just to reiterate, I say this, first I address why I'm saying it. Hey, you understand these are government-funded policies, government-funded plans. Let me give you my quick disclaimer that I have to give. Here's my disclaimer. Then I say, but listen, as your agent, I do my homework. I am only going to work with carriers that want to work with consumers and are going to do best by my clients.
Right.
There are plans that I do not discuss, and it's because they are not worth discussing.
Boom.
Mic drop. So Michelle asked, so if we're going to use your quarterly newsletters, will those disclaimers be added prior to uploading, distributing? Yes, Michelle. In fact, we currently, right now, if you look at like our Turning 65 letters, if you look at a lot of our marketing pieces, they're currently not available on the website because they have been submitted. They're being updated, and we have submitted them to CMS and various carriers who are requiring it for that. So if it's on our website right now, you're good to go. But we have pulled quite a bit. It will be up, hopefully before October 1st, obviously, but they will be back up there again to just after they've gone through compliance and get their assigned their assigned CMS compliance piece.
I love the pre and the post, how you just like bookended that disclaimer.
But you do.
I think it's
to.
Perfect.
You have to set the expectation as to why.
Because
like if somebody starts giving this disclaimer, it's kind of like, okay, we've been friends. Now you're doing this. Like, what's going on? It kind of makes them uneasy.
Right.
So you have to set the expectation of why they're getting the disclaimer, and then break down like, okay, but this is what that means.
Yep.
So, great questions. I have another question. Again, don't have your name, but got your number here. 1, I read that the Medicare Center frequently asked questions that CMS has new Medicare marketing rules for this AEP. A new, broader definition of marketing that expands the types of materials must be submitted to CMS. Do you know what these new rules for submitting are? Absolutely. That kind of goes back to marketing versus communications. Communications do not need to be submitted to CMS. So how do you determine what is marketing versus what is communication? Marketing, there's kind of 2 really easy rules to decipher marketing versus communication. Marketing, like I've already discussed, but I'll say it again.
Be a plan.
What are you trying to get somebody to stay on their current plan or to move other plans?
That's marketing.
That's marketing. Another way to think about it is if you have anything that could possibly be tied to any plan specifically. So saying $0 premium. Even though there's tons of plans out there that have $0 premiums, that's still a plan detail that needs to be submitted. Or saying Part B give back options. That's a plan detail. A lot of plans offer that. It's not specific, but it is a plan detail. Yep. So those are 2 things that kind of help decipher what is considered marketing and what needs to be submitted to the CMS. Now keep in mind, insurance agents do not have a direct line to CMS.
Right.
Not FMOs Not all FMOs do. Only FMOs of a certain size do have a direct line to CMS. Senior Marketing Specialist does have that. We also have an on-staff compliance officer so that if you have any pieces that you feel like, does this need to be submitted, does it not, send it to us. We'll have our compliance officer look at it. If it does need to be submitted, he will submit it. Right now they're saying it's more than a 45-day turnaround period on some of these pieces. So get them in. If you want to have questions, get them in.
Has SMS made any type of like compliance cheat sheet that says these are the 3 disclaimers? You need this one for marketing. You need this one for this.
Yeah, so there's a couple of them. Medicare Center also put out, and the same frequently asked questions, they also put out the disclaimers when and where. So they do have that. We also have white papers on sms-university.com talking about these compliance, and we've recorded like 6 videos in the last 2 months with Shaylin, our compliance officer, talking about these rules, regulations, and disclaimers.
Gotcha.
So we'll have more, but there is quite a bit out there.
Another question was, I also read agents are now permitted to make unsolicited direct contact with potential enrollees via email. The email must have an opt-out option in order to remain compliant. A compliant email would promote your services rather than any specific plans. Is this correct?
So that is correct. In 2019, CMS, again, because we all know what happens with CMS. They come out with these really crazy, intense rules, and then year after year, they kind of lighten them up. So in 2019, CMS did come out with saying that email solicitation was considered okay. So you could cold email Part C or Part D plans. Now, saying like they have to be talking about your services to be compliant, not necessarily. You can talk about $0 plans offered. You can talk about things like that. As long as it has the right disclaimers on there, you can do that. And of course, that marketing piece would need to be a CMS approved marketing piece. But if I were you, I would focus more on, as a good marketing technique would be to focus on your services versus focusing on a plan. So compliantly, as long as you have the disclaimers and the approvals, you can absolutely cold email market, no problem. You do have to have an opt-out option. Everything you're saying, you're very educated. Everything you're saying is correct. You can do it. You have to have the opt-out. You can talk plan specifics. If you're going to be talking carrier specific, that carrier has to approve it. But if you're going to use broad statements like $0 premium, Part B give back, dental benefits, then that has to be a CMS approved piece. But again, if I was an agent and doing email marketing, I would focus on my tools and resources.
For sure.
Yeah, my resources.
Brian says, my parole officer says I can't solicit anymore.
Yeah, Brian. Retire the fishnets, Brian.
Oh, perfect. Kind of just what I said. Can all these be put in writing for us to refer back to, please?
Yes, and again, we do have white papers on it. Go to sms-university.com, and you can find some of our white papers there. We also have YouTube videos, but we will be making more. We are 100% doing whatever we can to stay on top of all these compliance and regulations.
Terry from California says they have a new
requirement.
Got a lot of
Terry's on here. Good morning, Terry's.
They have a new requirement that requires a statement that I don't sell all plans, as you just said. Can I put near it a snarky comment about what I can do on the website?
Honest to goodness, as long as you have that statement, or as long as you say the disclaimers, or you have the disclaimers, you can do whatever you want after that. As long as you're not breaking another compliance rule, like saying that you're a part of Medicare or threatening to break hips for money. So you can do that if you want to. Like I say, what I always recommend doing is explaining and saying like, yes. And the biggest question I get with agents, and I know you even asked this, is like, but I do represent all plans.
Right.
I do. Like, there is not a carrier that I don't offer. And that might be true. If you do represent every single carrier, there are still plans that you don't have access to. So, example, like United Healthcare has the institutionalized options. Agents cannot sell those. Or there are companies like Clear Springs, which now they have more agents, but there's several direct-to-consumer products that you can't represent.
Right, like State Farm, like I can't
you can't
enroll.
Yeah, exactly. So there's always going to be plans, regardless of how many carriers you have. There will always be plans that you do not have access to.
Does this mean if you talk about MAPD plans on your website, do you have to submit those for approval even though you don't have any specific product info?
It depends on your contract. So again, that question is, just so everybody knows, that Medicare Advantage companies, and they've been doing this this is not new. They've always been recommending or asking that people submit their website to be overgo a compliance check or a compliance audit, if you will. That's not new. We've been having to submit agents' websites with their knowledge. We don't do anything behind anybody's back, but with their knowledge for years. And so if you do not, and it goes by basically that contract. So if you have a contract that includes the Part D or Medicare Advantage plans, even if they're not on your website, you're still contractually obligated to have your website audited. So it doesn't matter about what you're marketing, what you're talking about. It's what's that contract requires. So unfortunately, even if you don't advertise it, the company still require you to do it. I've only seen a couple of times where an agent or a company came back and said, absolutely not, you have to fix this. But they were like audacious things. I mean, like borderline, we're going to break your hip if you don't sign with us.
Oh, gosh.
Some of them were saying we're charging fees on top of receiving commissions, things like that. So it's not a big deal. Those have been rules since, I won't say when I started, because when I started, the internet hadn't caught up to what we were doing, or we haven't caught up to the internet, but like since 2015, 2016, it's been a requirement.
Wow, it's been a long time. Belinda, I love your question. Any compliant rules for meeting with your clients face-to-face besides the scope of appointment rules? Anything new for face-to-face?
Yeah, the only thing is that disclaimer. The disclaimer is the only thing that changes for face-to-face appointment. And, of course, making sure chain of enrollment, everything that led to that face-to-face appointment has to be recorded and kept for 10 years.
So if you're an in-person appointment, obviously that meeting isn't being recorded. Mm-hmm. So even though you say a disclaimer, like, what if something came back on you? Like, there's no way to proving that.
So that's a really great point.
Because there's nothing that you're signing or writing.
That's an age-old question, is how do I prove it? Because at that point, it's he said, she said.
Yeah.
Which is whenever we have people who come back with compliance violations, this is something that Shaylin taught me at a key accounts retreat we went to, which I think is just fascinating. That whenever somebody has a complaint to Medicare or a founded complaint, the first thing they do is the carrier will reach out to the agent and ask an agent a series of questions. If it's an appointment that is not recorded, which the majority of them haven't been because field agents didn't require that, then the questionnaire is about 37 questions. They have to answer and go through and account for 37 different points of that appointment.
And didn't you say it's like 6 for the other?
6. If it's a recorded meeting, there's only 6 questions. So if you can present a recording, if there's a founded or unfounded complaint to Medicare, if you can provide a recording, you have 0 issues. I mean, it's solved. It's taken care of almost immediately.
But how would you record a face-to-face appointment?
By simply...
Are you recommending that?
I'm not recommending that. Okay. No, I think life is hard enough as it is. If you're somebody who wants to be extra cautious, we have had it come up several times where agents, it was a he said, she said, and unfortunately, CMS is 9 out of 10 times going to err on the side of the client. So even then, the agent did nothing wrong.
Even if you, like, I don't know how you could do it on your phone, but, like, record the first 2 minutes of your meeting.
So what I would recommend doing is actually having something that we've created, and it's a Medicare Advantage summary worksheet. It's not a CMS-approved piece. I want to be very clear there.
Cover your ass form?
That one? Yeah, we call it the CYA form, but the appropriate terms are the Medicare Advantage.
So that disclaimer should be added to that.
It is getting added to that. And they sign off on it. They sign off that you discuss star ratings. They sign off you discuss PCP. Yep. And the reason that came across is we had an agent who had a client, was their client for decades, right? And the client ended up getting diagnosed with dementia, but didn't inform the agent.
Oh, gosh.
So then whenever the client ended up calling Medicare and saying, I don't know this agent, I don't know what they enroll me into, I've never met this person, and the agent had nothing other than like a signature and a scope of appointment to say, like, how was I supposed to know she was of sound mind? Yeah. She was there. It's our same appointment we have every single year. So that's whenever the CYA form was designed, was to protect that agent, because there was really nothing to say that he didn't lie and make this up.
Oh, my goodness.
Yeah. And that was a face-to-face appointment.
Nightmare situation.
Some more questions.
CMS has new Medicare marketing rules, a new broader definition of
we already answered that one.
Oh, did we?
Yep. That was earlier. We answered that. It was also sent in a text format.
Oh, okay. Yeah, those are the ones that were in the text.
So let me know, because I think I answered that via text, marketing versus communications, the new rules for submitting those. I think I already answered that, but if I didn't answer specifically what you were looking for, let me know. You can go back.
This person said, what you just said answered my question. It will be added to the MAPD and PDP plan recaps then.
I can't say for sure that carriers are going to do that, because reminder, you cannot edit a CMS approved document. So like if on an application, you can't write a disclaimer on an application. That's a CMS approved document. That is a federal document. You can't edit it other than where it's an editable field. But again, making sure that we include it into our appointments. We'll have it on our forms, things like that, to make sure, again, if somebody, to...
Right.
Yes. Yeah.
Brad asked, know much about Maximus working with Medicare. Sounds like Dynamic Solutions is not the only company with Medicare. Interesting talk with Maximus, 1-800-Medicare yesterday trying to conserve biz.
So they actually, again, Dynamic Solutions is one of the companies that handle the
There's
Medicare call
multiple?
center. They outsource it to Medicare call centers.
Okay.
Yes. Or they outsource it to call centers in general.
Right.
So these call centers, one phone call, they may be trying to help you return a vacuum cleaner to Walmart.
Yep.
The next phone call, they're answering medical questions for
Gosh,
Medicare.
that just makes no sense. Like,
Yes.
how is that possible?
They just completely outsource it. Dynamic Solutions is one of
How?
them. I've not heard much about Maximus working with Medicare. I don't know them. But I do know like there's several different national call centers that work with answering Medicare-related questions.
That's crazy. One of the questions was, could you explain the difference between a permission to contact and a scope of appointment?
I'd love to. So a permission to contact is exactly what it sounds like. And we all know with CMS guidelines that you are not able to solicit C&D plans. Even if the person knows who you are, even if it's like your neighbor down the street, they know you, you're not able to knock on their door and say, like, hey, would you want to set up your Medicare Advantage appointment? You can't do that. The only way you're able to solicit Medicare Advantage and Part D is if they are some sort of client with you.
Right.
So if they have a PNC policy with you, DVH policy, as long as they have something with you that shows you're their agent, you can reach out to them. There are a lot of situations where you sit down, you talk to somebody, or it's a friend or neighbor or family member down the street that they say, no, I want you to call me in October. I don't want to work with anybody else. I want you to call me in October. The only way you're compliantly allowed to do that, even if they're requesting it, is to have them sign a permission to contact form. And that permission to contact form has to be set for, again, you have to be really specific about when. So they have on there, I want to give Carrie permission to contact me during the annual enrollment period. Keep that on record so that you can proactively reach out to your client. Carrie can reach out to me, and I have proof that says I asked for this.
Okay.
So it's the only way that you can proactively call or call or door knock or anything that is MAPD or PDP related. It's if you have a permission to contact form.
And it has to be signed.
It has to be signed.
Not like I'm trying to think about somebody who left me a voicemail saying she enrolled in, is that one that self-enrolled? I don't know if you remember that. And she was like, she said, I'll call you in October or you can call me.
Yeah. So her saying like, and now if you would have called her back, answer her questions, that's completely fine. She reached out to you.
Right.
But if there's nothing, it's
That
July.
happens.
There's nothing that happens. And she says, can you call me in October? You need a permission to contact form. Yes. Now, a scope of appointment is just basically a government document that a client has to sign and choose what plans you want them to talk about. And that is only for Medicare Advantage and Part D appointments. Now, it will have specific products on there that you're allowed to talk about. So MedSup, Medicare Advantage, dental, vision, hearing, hospital indemnity, Part D. If it's not on the scope of appointment, you cannot discuss it. So if somebody signs a scope of appointment and you have to sign them before you go into detail about C or D plans, if they sign it, you are no longer at that appointment able to talk about financial products, long-term care, final expense, anything like that. But it has to be, you have to have it in hand and signed prior to discussing C or D at length.
Brian, you cracked me up. Yeah, a little Harpo's reference there.
I miss Harpo's. Permissions to contact at Harpo's. Got a lot of no's. I can imagine that, Brian. I can imagine. Judy has a really good question here.
Most of my clients are referrals. I feel you, Judy, and our incoming calls. Yep. Do I need to record those calls too?
Every single phone call needs to be recorded.
So how would an incoming call be recorded? I haven't thought about that. Like I have all my outgoing recorded on Ring Central.
Ring Central does record incoming and outgoing.
So I have my work cell forwarded to Ring Central.
So if you're going to do an outgoing call, what I would recommend doing, again in your situation, because you have two numbers, a three-way call.
Okay.
So you would call your number,
Call Ring Central.
and then
Call
your client.
Interesting.
Yes.
Okay.
All calls need to be recorded, guys, and that is
Yep.
because they are considered part of the chain of enrollment.
Mm-hmm.
The chain of enrollment means any single communication that is leading to a C or D sale must be recorded. So it doesn't matter if they're calling in or you're calling out. If it could potentially lead in a C or D sale, you have to record, keep it on record for 10 years.
We can do it, guys. It's going to be a piece of cake.
It's fine.
Because Med Center is going to help us out, right?
Medicare Center does both incoming and outgoing call recording. So Medicare Center will handle it. They will store it. They will put it in your client's profile. So Medicare Center, guys, is going to be a crazy
How
awesome
does the
solution.
phone lines work with Med Center?
So Med Center is very similar to what you're going to be doing. So
Okay.
Medicare Center is going to have
You get your own Medicare
you get
Center
your
line.
own, what I would call an enrollment line. You
Okay.
get an enrollment line that you have. And so if you're calling out from that, the way that it does is that when you call out, the way that it works is that your cell phone gets a phone call because you appoint whatever call you want that come in. Your cell phone gets a phone call and the consumer gets a phone call. So when you're answering it on your
cell
phone, but it's coming from Twilio. And it will look like a different caller ID.
Okay.
Same thing, when a call comes in, it's coming into that Twilio line, and you can answer it on your cell phone as well.
Got it.
So they're making it as easy as they possibly can, but yeah. The biggest downside is that it will be a separate number. They cannot use your current number. It will be a separate number.
Aren't you guys so thankful for Olivia?
Just ask me.
I'm so thankful for her. I mean, this is a lot of compliance. Like, are you ready for this to be like just October 1 and it's like people are moving and grooving and you don't have all the like anxiety buildup of it? Because I feel like it's going to be easier than what we were thinking.
I do think that. I think that if you're using the tools and resources available, and honestly, I think, and here's the thing. I saw a video recently that said, I'm not going to do this, so what's the worst that's going to happen? And
you don't get paid.
You don't get paid. I mean, that's not even the
lose
worst.
Your license.
What's likely going to happen is if you don't do these rules, you know you're not going to get paid. Worst case scenario is that you get turned into the Department of Insurance and they pull your license. That is worst case scenario. You know what I mean? You're not going to face a death sentence or anything like that, but that is your livelihood.
That's exactly what someone just said. I watched another couple of ladies on YouTube as well. One of them posted 5 days ago that they met with one of the major companies and they said they were not going to enforce the recordings of calls.
Yeah, we're talking about similar things here then, my friend. I was at United Healthcare in Dallas all last week, and we actually got to meet with the chief compliance officer there. And her message is, guys, we are doing everything we can. I don't want to get into the details of it because it's already 10:30. I want to be respectful of everybody's time. But long story short, she said it's happening. Call recording is going to be required. Mm-hmm. Is it going to stay forever? I don't think so. But it is going to be required in the next year. They right now have gone off from trying to make it not required to delaying it to give us more time to prep for it. But it is happening.
Yep.
And whoever is saying I talked to the largest organization, United Healthcare is by numbers genuinely the largest Medicare supplement and Medicare Advantage provider. And they're saying that, yes, call recording is happening.
And it starts October 1st, correct?
It starts October 1st.
Okay. We've got like 6 more questions.
And I want to answer them. I do want to answer them. I will let you guys know I do have a hard stop because I'm going to be on CSG's webinar. We're doing a webinar with CSG, and we're talking about seminars on that one. So I do have to make sure I get off of that. But I do want to answer these questions.
What if a prospect booked a time on my calendar? I capture their information. How do I create or need a permission to contact?
Okay, so if a prospect booked one with you, you did not proactively reach out to them. So you don't need a permission to contact. If somebody's calling you requesting an appointment, if there's a phone call, an email, using your Calendarly, social media, smoke signals, doesn't matter. If they're reaching out to you, you don't need a permission to contact. It's only if you want to proactively reach out to somebody that you need that permission to contact.
And yes, Ring Central functions the same as Med Center, correct?
Yes. Similar, different interface, but yes, can work the same.
I thought you said if you are just setting up the appointment, no recording. I misunderstood disclaimer. Does not have to be said when setting the appointment, but does have to be recorded. Correct. It has to be recorded, but the disclaimer doesn't have to be said unless you're presenting plan information.
Yes. And Judy, yeah, you can listen to the CSG webinar. I think we do have a link to it on our website, smsteam.net. We do have a link to the CSG webinar. Otherwise, you can go to CSG's website and sign up for the webinar there as well.
One of my carriers said that their interpretation from their attorneys of the rule is that the call recording rule is only for the call centers.
Mm-hmm.
We wish. I know I will record every call.
It very much said. Now, and I understand why, because whenever it initially came out, CMS has to give an initial one to all the carriers and saying, this is what we're going to do.
Yep.
Let us know how you want to combat it. So they came out with call recording, and the carrier is like, yeah, no, that makes a ton of sense. We're having issues with our call centers. Make them record it. Sure, perfect. Whenever CMS actually came out with it, they did a clarification on TCP or TPMOs. And that very much clearly states field agents are included. There is no combating that. There is field agents are included.
Because they couldn't determine who was who, right?
They could not determine. They said if you look at the contracts and you look at the processes, call center agents and field agents by legal jargon and terms are the same. And so that's what it was talking about after the first of the year. If they can say, okay, let's pull some call center agents, let's pull some field agents, listen to the phone calls, listen to the processes. If you can show me and make legal arguments why these two are different, it'll be reevaluated. But that's the last I heard.
Michael asked, if I have an administrator call my current clients, does she have to record her calls as well?
Oh, that's such a great question, because that's a gray area. She's not a licensed agent. She's not held to the same standards.
What if she is licensed?
If she is licensed, if she is licensed.
So my assistant is not licensed.
Let me finish. But she's representing you.
Right.
That is a gray area. I'll tell you this, on paper, Michael, I'm going to say it like this.
It's safe to say, yes, record everything.
Record it, because it's part of the chain of enrollment. It's the same thing I'll say it like this. I know it has to be recorded because lead vendors who are telephonic, they are not licensed agents.
Right.
They do not hold a license. They have not held a license for years to try to skirt these rules.
Mm-hmm.
They are now responsible for it. So, for example, your administrative team, Medicare and CMS would view them as a lead generator. And will your administrator get in trouble for not recording her phone calls? No. But you, because that's part of the chain of enrollment, you are held accountable for the lead generation. So you will be held accountable for her recording her phone calls.
Do we know what the reprimands are of, you didn't have a call recording, or let's say you record the call but forgot the disclaimer, or are they gonna...
It'll be like anything else.
Okay.
The first time's a slap on the wrist. You may have somebody come out. You'll get more new modules sent to you for training and things like that. If it's a consistent issue that you are not fixing, you'll lose your contract. Okay. Yeah. So it's just like with anything compliance. Right. It's all about intention.
Yep. I don't think there's any more questions on there.
I think that's all of the questions on the chat.
No more on the tech. Oh, just kidding. One more. If I'm talking to a potential client now, I don't need to record it now, do I?
No.
Not until
this
October 1st.
Starts October 1st. But I would go ahead and get the
Used to
systems and processes now. If you try to implement a new system October 1st, you're going to have a bad time.
I told myself August 1st.
So How's it going?
Good.
Really?
I haven't been good at, incoming calls are being recorded. It's the outgoing that...
Because you're doing it
because
from
I want them to, they know my work line that they call, but if I call them from my Ring Central line, that's a different number. So
are you working that into your appointment?
To figure out what?
Are you working that into your appointment to talk about the lines?
To talk about? Oh no, I haven't yet because I'm trying to figure out if I can resolve that issue before I tell them I'm going to have.
I think that would be ideal. What I always like to do is actually take their phone. And we actually had an agency talk about this and say hey, can I
have two numbers?
Yeah. And so what you do is you take a selfie with you and your client. So you post that as when you call, that picture of you and your client comes up.
Oh gosh.
And then you actually put both numbers in. So that regardless of how they communicate with you, that picture of you comes up. So you can try that.
It's a good idea.
Or take a selfie.
I'm also on my newsletter going to put both numbers on there.
I would. But again, the more I know if I see a phone number come up, I don't add it into my phone.
Right.
I don't. And so you can either that or send or text your contact information to them and say just here's how you add it. But I know a lot of people have success at being give me your phone, let's do this together.
Interesting.
Your fun, your more savvy clients. You're the guy who you've met with 3 times would do really well with that.
He would.
So I think that is all the questions, comments, concerns.
Thank
that's
you
the
guys
promises
for
we
all
have
the
for
interaction today. It was
This
awesome.
has been really fun.
This means you will have to read every word of every appointment.
Of every app when with the client. So
Read every word
technically
of every
that
app.
has actually been a rule for a very long time. When you're going...
Whoa. This just blew my mind. I haven't even thought about this.
Yeah.
Yet.
What part?
Read every word of every app.
Technically that's always been a rule.
I know, but like...
But like no one does it.
Whoa.
Your appointments might be a little longer if they're
Whoa.
Because like you have proof of saying this. Because that's always been a rule, but you could never prove
that you read all that.
But here's the good side. So one of the top complaints to Medicare, and complaints to Medicare, guys, is a very broad term. It doesn't mean that you mess something up and somebody's pissed off and they complain to Medicare. Complain to Medicare could literally be somebody doesn't remember what copay was on a prescription, so they call Medicare to find out their copay. That's a complaint to Medicare. So, and that's actually one of the top complaints to Medicare, is saying like, oh, I don't remember what my copay is. Let me call Medicare and find that out. That is a complaint. That is a compliance violation. Because CMS approves it, if your client doesn't know it, it's because you didn't discuss it.
Tell them.
And so when you record it, you can show, no,
yes, you did.
I did go over it. It's in minute 27 of this appointment.
Right, but like, you know, I go over all of that stuff, but I really don't read every single line. But hopefully... Here's another thing. Just make sure your clients get all materials, which has also been a rule. Right. Make sure your clients get all materials, so even if you don't word it verbatim, again, I shouldn't say this on a recorded line, but even if you don't read it verbatim, they have the content. They have the content. Yeah. So as long as they have the content and you go over the summary of benefits, the application's not as much. I love National General Allstate, their application. On the very first page of the e-app, it sends them all the documents.
I love that.
I love that. I just love that.
Here you go. I don't want to think about this anymore.
I love it.
Guys, thank you so much for being our friend. I do have a hard stop that I have to get ready for to do our CSG webinar.
I think that was everything, though.
I think that
officially
is
everything.
But feel free. Yeah, and that's my concern. I genuinely understand.
Yeah.
Feel free, guys, if you do have any more questions, feel free to reach out to Carrie and I. My email address is olivia.richardson@smsteam.net. Feel free to shoot me your questions for Carrie and I. We will discuss them on the next Medicare
compliance
Cafe.
questions, I'm just going to confirm them with her, so...
It's a lot, and you're welcome, Terry. This is something that we find incredibly important.
Yeah.
We also, guys, just so you know, our National Senior Sales Summit is next Thursday. Go to SMS Team. Yes. 17th. Go to smsteam.net. I'm actually doing a main stage speech this year. I'm very excited, and the title of it is "Success is Not an Option," and it talks about all of this.
I love it.
How to make sure you are ready to be successful during AEP, because success is not an option. So that will be my main stage topic. We'll also have Medicare updates. We have a panel of really successful AEP agents to give them their top highlights. And then Carrie and I did a breakout session together talking about your success with networking. So it's free. It's free. Go to smsteam.net. It's the second tab of the scrolling banner. Register for it, and we'll have a lot of cool content there.
Thanks so much, guys.
Thank you guys for your patience. We'll get through AEP together.
That was a good little jingle.
Thank you. I worked on it all night. All right. So until next time, guys, have fun.
Make money.
And give impeccable service. Thanks, guys.